Eric wants us to be calling.
So Ashley is the clerk today and Janine is the host.
I'm going to put us on.
So for all the people who are just joining, if you could just make sure that you are muted until it's your opportunity to address the council committee. We'd appreciate that so that we don't have any background noises.
Hey, Yvonne, the meeting is live now.
Okay, thank you, Janine. All right, I'd like to call the Health and Human Services and Aging Committee meeting to order, 106. And can we have a roll call, please, Madam Clerk?
Calling the roll, Ms. Conwell,
Present.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown.
Here.
Mr. Miller,
Present.
Ms. Stevens,
Present.
we have a quorum.
Thank you. Has anyone signed in for or sent any public comment today?
No, Madam Chair, no one sent any public comment.
All right, we have the minutes before us for the July 29th, 2020 meeting. Can I have a motion to approve in a second?
Also moved Dale Miller.
Second, Brown.
All right, all in favor of the minutes for July 29th, say aye.
Aye. Aye.
All right, thank you.
Mama can go furthest away.
I apologize for that. They just came through the door while I was trying to get on on the committee. There are several matters referred to the committee today. Madam Clerk, if you could read the first item into the record, please.
Resolution number 2020-0167, authorizing an amendment to contract number CE 1700154 with Case Western Reserve University for fiscal agent services in connection with facilitation of the first year Cleveland Initiative for the period June 1, 2016 to December 31st, 2019, to extend the time period to December 31st, 2021, and for additional funds in the amount not to exceed $1 million.
All right, and who is here to address this today?
Good afternoon, David Merriman, Director of the Department of Health and Human Services. Before I begin the presentation on this item, I just want to recognize that here at the headquarters is Christine Alexander from Contract Administration and Performance, CAP. Christine is a support on all of these contracts. This first item I will be presenting. We will have Kevin Gowan and the JFS team presenting the next item, and then Ruth Gillette and Melissa Sirach will be presenting the HOMA service items. If you're any providers and you've called in, if you're a provider and you've called in on this item, please remain muted until your item is available and questions are asked. So I am going to begin with presentation on the first year Cleveland contract with Case Western Reserve University. Bernadette Kerrigan has joined us by Zoom. She is here to answer questions about updates. I'd like to begin by just recognizing this item is a 2-year MOU. It will include 2020 as well as 2021. I do have to acknowledge there was a miscommunication, and there was a belief that the item was approved in 2019 through the budget process. We've recognized that's not the case. We've brought the item forward for consideration today. We're certain this miscommunication will not occur in the future. The item before you is for support, county support for the first year Cleveland program, which is a multi-year approach to address infant mortality throughout Cuyahoga County, and especially racial disparities in poor birth outcomes. This program is a critical response to racial disparities in an established health issue, public health issue. The county's portion of this is $500,000 a year, and those funds support Case Western Reserve's management and contracting for services. I can say that overall infant mortality rate has decreased from 10.5% in 2019 to 8.6% in 2019, and through June of 2020, it's dropped to 8.2%. Similarly, there have been reductions in the preterm birth rate, in the non-Black and Hispanic infant mortality rates. So there has been progress, but let's be clear, more progress is needed. Continued support for this program is needed. And we are here to answer questions on the program, how it's going, and see if there's other information we can provide.
David, what do you think has attributed to the decrease?
So I'm gonna, I will say to begin with, I believe that a lot of this has to do with the partnership that has been established by Case Western Reserve University, by the organizations that are working together jointly, by the sustained funding for this initiative, and largely the public investment. But let me ask Bernie how else, or what else she would add to that.
That is correct, David. I think us coming together and working more collectively, we've expanded home visiting by over 1,000 slots. We have increased centering pregnancy. We are doing mandatory racism training within the hospital systems. So I think we are doing, we have 1,500 now sleep angels, families around the county that are supporting other families for safe sleep following the ABCDs. We have been working on the tobacco issue. Decreasing tobacco has improved our premature rates. So it's, I think, the collective impact, and we are addressing racism head on, which is the #1 reason our babies are dying at the rate they have died for the last 6 decades.
All right, Bernie. I want to say last year or pre-COVID time, the numbers were decreasing, but there was still an African-American high level in that community. Is that still the case, or overall, with the 8.2, we have decreased in both, in all communities, I should say?
We have decreased by 23%, but there is still significant disparities. With that, 37% decrease was in whites and a 17% decrease in African Americans. So that is why we are urgently working on issues such as the film Toxic, the Black Woman's Story, therapy for Black expected parents and new parents from Black therapists, all the work we're doing on anti-racism efforts, because we still have a significant disproportion rate between whites and Blacks dying when their medical behavior is not different. They're very similar. So we still have a ways to go, but we are on the right path.
Okay. All right, I'm going to open it up to my colleagues. Any questions?
Yes, I have a couple of questions.
Councilwoman Brown.
All right, thank you. Hi, Dr. Bernie. It was a pleasure working with you in this endeavor. But as you pointed out, there is significant work that still needs to be done. Can you just elaborate a little bit on how these funds will, more specifically, what they'll be utilized for?
Thank you for your work on Action Team 2 and other places. Yes, this funding is critical. Only about 1/4 of your funding goes for staff support. Your real work is out in the community. I just got off the 200 people were with Better Health Partners and Action Team 2. Action Team 1, all 3 of the hospitals. This critical funding will continue to work with the hospitals on working with all employees on racial bias testing and training. This work will also assist in giving dollars to Action Team 2 so they can continue their work of the voices of African Americans being able to share their experience, so us that are not Black can really understand racism and its negative impacts and then change our behavior. It is going for funding for safe sleep. It's going for funding of making sure we have the data broken up by race and neighborhoods so we can appropriately do that. And it also is looking at best practices around the country. We are kicking kicking off our strategic plan and equity strategic plan, making sure our staff, our board, our policies all pass the equity lens, and then model that to now over 700 partners and committed people working with First Year Cleveland.
Okay, and so one of the things that I will, with some bias, like hearing is that the Pell Committee will be receiving some additional funds. Is that what I heard? Correct? Did I hear that right?
It's funds that they're using right now in year 2. So the work right now, so your dollars would be going to support the Wave of Lights, which is on October 15th. That, as you know, is an event that honors the babies that we have lost. And it is an event that's created from beginning to end by the families that have lost. This is also going to the OWN, which is the group that has created the Black therapists working with Black families. So you are correct. This will be continued to not only work on all of the current 11 action teams. We think our our strategic plan that will wrap up at the end of this year will activate new action teams starting 2021.
And what about BBC, Birthing Beautiful Communities?
Birthing Beautiful Communities is several places in First Year Cleveland. One, Jasmine Long sits on our executive committee. BBC does get dollars from the home visiting program. We oversee the $4.8 million from the state, so they get a chunk of dollars there. They're one of the larger funded there. And as you know, they are going to be playing a significant role in the sustainability of Action Team 2 work.
Right, and so as it relates to these funds, is that part of Birthing Beautiful Communities? Will they be recipients of the dollars that we're approving today?
They're part of the dollars of now. We have a transition plan from Action Team 2 that the executive committee will be hearing in November to understand what's needed in the future.
That completes my question. So now, thank you, Councilwoman Conway. I was deeply, clearly involved, so I have probably a little bit more familiarity with this work, and it was great work and well executed and led by our very own Sabrina Roberts and Tracy Carter. They did a phenomenal job of the Pregnancy and Infancy Loss Committee and did a lot of great work, which I think Dr. Burney can probably second, that they exceeded the expectations and the goals and objectives that were laid out before them.
Yes, they did.
Thank you. Thank you for those questions. Any other committee members?
Madam Chair.
Councilman Miller?
Thank you very much. And I congratulate the leaders of this program on the progress that we've made so far. It's heartening to hear that we've seen reductions in infant mortality in both Blacks and whites, even though the disparities remain and we have more work to do. I do have one concern about the resolution of a somewhat technical nature, and I've seen this before. The way the resolution is worded, it says $1 million for fiscal agent services, kind of suggesting that we're spending $1 million on administration, where this is not the case, and most of the money is eventually going toward program services. And so I would like to move to amend to change the language in both the title and section 1, so that instead of for fiscal agent services, it says fiscal agent services, facilitation and contracted services in connection with First Year Cleveland, ...
All right, can you make a motion for that, Councilman Miller?
Yeah, that was a motion. I think it'll just make it more clear as to what the money is actually being spent for.
All right.
Second, this is Councilwoman Stevens.
Second from, okay, second from Cheryl.
Madam Chair, can I
All
ask a
in
question?
favor of that? We'll hold that vote. Yes,
Yeah, I want to check in with the law department to make sure that's not a reference of any contract language. And that the contract, the MOU that was signed and by case and is available, can accommodate the change in the legislation. Certainly think, Councilman Miller's recommendation in terms of the framing of the request makes perfect sense. I do want to just know from the law department if that is going to require a revision in the MOU, or if that's something that can, if there's a separation between the two.
Okay, so we can hold off on that. Is there law representation on the call today?
Yes, Victor. Victor,
Okay.
you're on. You're unmuted. You should be able to go.
Hello?
Yes. Hey, Victor.
Yeah, I'm filling in for Tyra Taylor today. I've looked at the MOU. I don't think it would be a problem, Dave. And
Okay.
I can certainly double check once the proposed amended language is finalized, but I don't think so.
Thank you. Thank you, Madam Chair.
Okay, so we can go ahead with the vote to amend, and I'm sure it will work itself out by the committee meeting of the whole. So it's been moved and it's been seconded. All in favor of the amending the language, say aye.
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 All right.
Excuse me, Madam Chair, if I may ask Councilman Miller if he could possibly repeat that language?
You're on mute.
Unmute yourself.
Okay. In the title and also in section 1, we're going to replace for fiscal agent services in connection with facilitation of first year Cleveland, and we're going to replace that with Case Western Reserve University for fiscal agent services, comma, facilitation, comma, and contracted services in connection with the first year Cleveland initiative. ...
Thank you.
All right. Does that conclude your questions, Councilman Miller?
Yes, it does. Thank you.
All right, you're welcome. And I noticed that Councilman Jones is in attendance. Is there any additional questions to R2020-0167 at this time? All right, hearing none. Councilman Jones, were you
Yes.
on when we amended the legislation? I just noticed.
I did weigh in for the amendment.
Okay,
Yes.
all right. So and to David, is this second reading suspension needed? You're muted. Didn't hear anything.
Yes, thank you. And thanks for your patience there. The county has not provided any funding to this program this year. And as the contract has not been available, so yes, it would be great to have this in second reading suspension.
All right, thank you, David. I'd like to have a motion to move this to the full council second reading suspension and then a second.
Also,
Second Brown.
All right.
Madam Chair,
Miller on-
one question.
Yes, Councilman Jones.
You mentioned there were no additional funds for first year Cleveland. Were there any dollars received in relation to the Fatherhood Initiative? I know early on, Fatherhood Initiative was given dollars. Has there been any other funds other than county?
Are you talking about in particular to this legislation?
Right, to this piece of legislation. For
Okay.
first year.
So I'm going to ask, I'll ask Bernie to reference, is there a subcontract relationship with the Fatherhood program?
The Fatherhood program, when ODM stopped funding through their infant mortality grant, direct grant through us to the Fathers Program, we tied it into all of the action teams. So they have been heavily involved, the Fathers Programs, and we added them within home visiting, centering, on Action Team 2, the parents that have experienced a loss, the fathers have a large voice, and Al Grimes has been representing them, and still Steve Kilback, but many other fathers join in many of this work. But there is no direct grant that has been requested nor given directly to the county fatherhood program since you.
All right, thank you.
All right, moving on, if there's no further questions, it's been moved and seconded. All in favor of moving this to the full council under second reading suspension, say aye. Aye. All right. Thank you very much. We're going to move on, and Madam Clerk, if we can read the next item into the record, please.
Resolution number 2020-0199, authorizing amendments to contracts with various providers for the Propel Cuyahoga Workforce Services Program for the period July 1st, 2019 to June 30th, 2020, to extend the time period to June 30th, 2021, to change the terms effective March 9th, 2020, and for additional funds.
Madam Chair, David Merriman, Department of Health and Human Services. I'm here before you with the proposed amendment to our contract with the Centers for Families and Children and their subcontractors, as well as Maximus Human Services Incorporated. This item is the first amendment of our contract for TANF workforce services for adults that are receiving public assistance. We came to you last year with some significant changes in the program and the way that services have been provided. So this new model represents a new delivery approach for mandated work activities that also accomplish workforce service outcomes. This does require our providers to coordinate all services for the population, and the model has been undertaken because we believe that, yes, we must be compliant with the federal government as a grant recipient, but we also must be able to address the workforce needs of county residents. Kevin Gowan will be presenting in a minute, but I do want to just recognize this program has been in place since July. There was a period during the height of the COVID increase where we were negotiating very actively with our providers, wanting to right-size services. As many of you know, training programs were closed, community colleges were closed, most services were closed, and people were unable to stay home for their own safety. So there has been extensive contract negotiation and right-sizing of this new model. We fully commit to restoring the model and looking to achieve the outcomes that we initially proposed as we move through COVID. I will also say that, you know, we are also committed to the safety of our clients, our staff, and our providers, and want to ensure that whenever possible, we're not bringing people into programs that could jeopardize their health. So at this time, I'm going to turn it over to Kevin Gowan, the administrator of Cuyahoga Job and Family Services, and Kevin is joined here by Paul Bounds. I also know that we have representatives from all of our providers on this Zoom call, and they are standing by available to answer questions. Kevin.
Thank you, David. Thank you, Madam Chairwoman. I am Kevin Gowan, I'm the JFS Administrator for Cuyahoga County, as David mentioned. This is the first amendment of the contract to provide workforce services for low-income cash and food assistance recipients in Cuyahoga County. This provides a variety of employment training activities, work experience, supportive services, academic remediation, case management, follow-up activities for work-required individuals. This is a federally mandated program that uses federal money dedicated to the workforce program, to the TANF program specifically. In 2018, as David mentioned, we sought to redesign the workforce program from contracting with multiple providers to offering a single standalone provider or providers that would serve clients through every stage of the program, participation from enrollment to the client's exit public assistance. These services were competitively procured back in 2018. We commenced July 1st, 2019. The two highest scoring proposals were selected. Their primary goals are to help participants achieve wage growth, help participants progress in careers, growth potential, including education, and create for county businesses, a pipeline for county businesses to improve economic equity within the county. This is in keeping with the county's strategic plan that in goal 6, that every resident has a path to self-sufficiency and mobility, and in making a difference in everything we do, in providing and implementing an outcome-based contracting process. Providers are also asked to ensure that the services they propose and provide meet allowable work activities for the federal program, which offer clients the opportunity to meet their work requirements. During COVID, both providers continue to operate, delivering services to the cash assistance and food stamp population remotely where possible. They're currently providing services remotely and in person on a very limited basis, as we are encouraging remote services where possible. During the first program year, we served 1,245 individuals. The 240 of those individuals received full-time employment. Both the centers and the Maximus have met several of their program outcomes, performance outcomes. The centers specifically have been meeting their participation rate benchmarks. They've exceeded their 90-day job retention benchmarks and their 180-day job retention benchmarks, and they've exceeded their client satisfaction rate. Maximus has consistently met participation rate benchmarks, exceeded the placement rate benchmarks, exceeded wage level benchmarks, and exceeding those who attain credential training. They also exceed client satisfaction ratings. At this time, I can either break for questions, or if either Maximus or the centers would like to talk to some of their successes with the program so far.
Director Gowan, I wanted to know, has the federal government given us any leeway on the workforce participation?
The federal government has not provided formal waivers regarding that program. They have indicated that they will be lenient when looking at this in the lens of COVID and what we've all experienced over the past 6 months, but they've not provided formal waivers.
Okay, I think the committee would like to know a little bit, I guess, from each program, how they have gotten around or assisted during the COVID-19 with the mandated workforce training.
If I could turn to Monty Starks, I know is representing here from Maximus.
Good evening, everyone, council members, and everyone present. My name is Monty Starks. I'm a project manager for Maximus here in Cleveland. And it's a pleasure to be here with you today. So for us, what we did during this time of crisis is we were able to move our services totally remotely, where participants could participate in our program without putting them in any harm during the time of COVID-19. Our robust system allows them to be able to do hardcore training as well as soft training within our systems, ensuring that they meet the required hours for the program, at the same time remaining safe while at home. We provided resources that allow those individuals who were not fully connected to internet services or did not have any other technology to be able to fully participate, connect them with resources in order to do so. And then we worked hand in hand with them to make sure that they were still able to complete the maximum number of hours within the time frame allotted to them. We continue to do so. We remote our services. We communicate with them constantly, daily, and we do several activities. We created what's called a virtual social hour. And this is an opportunity where participants meet with us once a week for an hour, and we provide them the necessary resources, discuss current issues, and talk about employment opportunities during this time of COVID-19. Likewise, we have weekly job fairs, and then we connect them with what's called work keys to be able to ensure that they get the necessary skills and training in order to move forward in their program. Lastly, we still work with them while developing resumes. Well, we have our system called Optimum Resumes, where they can go in and do mock interviews. They can continue to do training, resume writing, cover letters writing, and then we assist them finding employment that allow them to work remotely from home. We have developed a list of different employers whose solely purpose is to employ individuals to work remotely home, and we connect them to those resources. So those are the number of things that we have done remotely to allow our participants to still get the necessary skills in order to become successful and self-sufficient while remaining safe within their homes.
Mr. Starks, were there any participants that had any issues with Wi-Fi or computer access?
Yes, we did have a small number of individuals who did not have access to internet. And what we did is we connect them with several resources that were available to us and help them connect to that internet. So currently the resources with different agencies that either offer free internet services or they offer a reduced cost of internet service based on their income. And we ensure that those individuals connected to those resources within the community.
Okay, so on the reduction of cost, based on the participants' income, I'm taking it that they paid, correct?
Depend on income. We do not know the full extent of the background income, but the agencies or the entities themselves would take a look at their income and based on the services they receive. So the odds are 9 out of 10, they did not have to pay for those services. These are individual companies like AT&T, Sprint, T-Mobile, and other agencies like 823. These were different agencies not totally controlled with us, but we have a partnership with them where we'll connect them with individuals who needed those services.
And from your opinion or your data, do you think more participants participated during the pandemic or prior pandemic?
No, I would say we had a significant increase of participation during the pandemic. The fact that they were able to be remotely at home, we saw a huge increase in our orientation as well as our curriculum when we provided services.
Okay, so that may be something going forward. I'm going to open it up for Mr. Starks. Any questions for Mr. Starks?
Madam Chairman, this is
Okay.
Councilwoman Stevens.
I saw Brown first and then Stevens.
Okay.
All right, thank you, Councilwoman Conwell. Thank you, Councilwoman Stevens. My question is for Mr. Starks. You indicated there was a small number of individuals that needed Wi-Fi assistance. You also mentioned that you provided the tools and resources. I'm presuming that means laptops. Could you put a number to both of those figures, the Wi-Fi and the computers that were distributed through the program?
So we had, I would say we had approximately, out of the number of people served, no more than 35 individuals who needed that services. And out of the 35, I would say 90% of those individuals were connected and received that service, either being Wi-Fi or a laptop or some form of computer to assist them with the program.
And were you the conduit for the computers, or did you direct them to another organization?
No, we use third-party entities to provide that service. We did not provide the computers directly, but we connected them with third-party individuals that can provide that service.
And who was that?
AT&T, PCs I believe it's PC to People was one of the agencies that we used.
All right, and if you could give us the list of a specific breakdown relative to those. I understand you said there were 35 by the total number served, and what was that total number served again?
The total number we served for the year was 821.
Okay, and that's year to date?
That's year to date.
Okay, thank you, Councilwoman Conwell.
All right, Councilwoman Stevens.
She asked my questions.
I'm sorry.
Every one of them.
Great minds think alike. Okay?
I guess so.
I'm gonna open it up to any other questions. All right. Can we hear from the other the centers? and what they did during the COVID-19.
Good afternoon. Thank you for having us. My name is Carol Beatty, Chief of Programs for Family and Work with the Centers. And we were able to quickly move to a remote model as well. We have seen an increase in clients. We currently work with clients to connect them to resources. It's part of our intake. I wanted to introduce Missy Rosanella, who will talk in more depth around the current work that we're doing. Missy?
Hello, everybody. Thank you again for this opportunity. So yes, much like Maximus, we were able to move very quickly to remote work. We did see an increase in engagement. And actually, our employers were also very excited to continue or working with us at this time. We were able to continue to provide employment services from the start of COVID, even through
If you could talk a little bit closer to your mic.
Sure. Sorry,
And I think Monty needs to mute his mic.
Okay.
Will do. My apologies.
Sorry.
All right.
Is that better?
Yes.
Okay, great. So one of, I would say one of the distinctions that we were able to do very quickly, despite the uncertainty when COVID initially hit, was we were able to engage our employers who were already participating in our day-to-day presentations and consistently participating in our curriculum. They moved to remote very quickly. And while there was some uncertainty up front, they very quickly still needed to bring people on to positions that were still needed in those in their organizations. So while we were able to provide, you know, a lot of the clients, and while Wi-Fi connection is an issue, it's a smaller issue for a lot of the clients because a lot of them have access through their phones. So a lot of them have smartphones, and we were able to connect with smartphones. Very small percent don't have access even through a smartphone. They have an old flip phone, which I believe some people still have. But we're connecting with those people as well through phone calls and conference calls, and we will be opening up limited on-site services because we recognize there is a certain amount of the population that really does need to come on site and have additional services. But of course, we're following all of the CDC rules and making sure that we have the social distancing and scheduling and all the PPE in place. So that will be happening very soon. And I think, I don't want to say anything that Monty didn't say, unless Lisa or Patty would like to chime in. I think that we've been engaging the clients at about a 80% rate. So that's very exciting considering that we are going through this time. They are experiencing some additional challenges that I'm sure is not a big surprise. The clients now, of course, are now having to work with their children at home. And so that is creating a new challenge in finding them employment, but one that we are really trying to get creative around and finding ways for them to participate with their children, for instance, and make sure that their kids can be a part of the program and learn with their parents. So we're really excited about actually some of the opportunities that COVID has actually brought to the programming and the things that we have gotten to learn from it. And with that, unless Lisa or Patty or Spence would like to say anything.
I'll chime in a little bit, Missy. Hi, I'm Lisa from Verge. Also, I would just like to add that we have been really doing a good job at assisting them with real life issues. We've been directing them to places they can go to avoid evictions, places that they can go for people who lost their job and now their bills are piling up. We've been able to redirect them to get assistance with that and identify jobs. Like one young lady needed to get more money, so she's now working third shift so that she could get the shift differential to help catch up with her bills. So we've been doing a lot of connecting them with resources to help mitigate some of the issues that COVID caused.
All right, is there anyone else that would like to chime in?
Yeah, I would like to. My name is Patty Berenice, and I'm from Catholic Charities. I'm a partner with the centers and Verge, and really pleased with our cooperation and relationship building that we've been able to do throughout this past year, which is quite remarkable. For Catholic Charities, we work with the clients that are have barriers and are unable to do their work readiness programs. And so we've been really working with our clients more around preparing them with their children and schooling and how to have relationships with their neighbors and their family members so that as we're moving into our winter, We understand that it's not going to get any better for them. And so we're very planful and mindful of school pods, working with our neighborhood centers at Catholic Charities to develop pods and places for our clients to be able to have virtual learning for their kids, and just having those conversations with them. How are they going to be prepared for this winter when it gets cold out and we still have this COVID to deal with? And some of the children might still be home, or relatives are coming and going. And so just being really mindful of utilizing the dollars that have been available that have been offered to them through the PRC, and being really planful of how they're going to be hunkering down as they get through this fall into the winter, and just having those open discussions and really being able to do a lot of telehealth with our clients. We've really been very successful with employments and SSI, and we're very pleased with the numbers that we've gotten so far. So that's all I wanted to share. Thank you.
Has the need grown for additional, Patty, for the additional individuals or the clientele? Has the resources increased, the need for resources like food and things of that nature?
Well, yes, but it's mostly about being able to give them the right direction of where they could get those resources, or knowing that those resources are coming through. So understanding the resources in Cuyahoga County, understanding how the school systems were putting money on food cards so that they would get those $60 that their children would have gotten. They knew about that. There were special allowances in COVID PRC for essential items, and really being mindful with our clients to understand what does that mean. And so being able to get those resources that aren't readily available in the community, because nobody was really ready for COVID, and what did that really entail? And so really working with them to use those dollars appropriately. Who has buds for their kids to be able to do online classes so that, they have a quiet and space, and what do they have available to them so that they could take care of their children, and yeah, so it's really it's more about being neighborly and connecting with each other. A lot of programs shut down and went virtual. Now they're starting to come back, but while everything was shut down, how did we get them to have relationships with each other that were healthy, and being able to reach out and be connected with their therapists or their psychiatrists or their drug and alcohol programs? And so teaching them how to do it, doing Zoom with them, having them do telehealth with them, and feeling that comfort level, they got to practice with us. And so they were really comfortable with the services that they were able to do.
All right, any other questions for Patty from Catholic Charities? And we don't want to leave out any questions you may have had for Verge, which was presented by Lisa Evans, or for the centers. So opening up to any questions for any of those organizations.
Madam Chair.
Madam Chair.
Councilwoman Brown, and then Miller.
Thank you very much. So my question is just, and anyone can answer, with the medical appointments, I'm assuming that they schedule them and then you're assisting them in advance with how to execute on them. But are we tracking how they were directed, or how many people have been kind of redirected from physically going to see their doctor to utilizing the teledocs and telehealth services? Is that something you've been monitoring, or is that just a service we're providing to assist them? And the reason I ask is because it just kind of is a little bit concerning, to your point, where people have been accustomed to that person-to-person connection and losing that, and then having to go into some very unfamiliar territory. How are we monitoring that transition?
Well, I know for our clients in intensive case management, we don't necessarily monitor it. We're always individualizing the program. So what that client has, when it comes to, when it came to COVID and we were working through things, we would take a very broad approach to it. And so we would have initial conversations with our clients to say, what about your children's medical? What about your own medical? What about, very broad, And when they did have an appointment, and getting them to schedule them and keep them, and then when they were told how they were going to have their appointment, whether it was going to be face-to-face or via Zoom, that we were walking them through that process so that they could feel comfortable sitting with their child and having that conversation with the doctor.
I'm just, and this is not a reflection or anything on the program or you, but it just hearing that just gives me concern about those that could be potentially slipping through the cracks. That I will admit in this public forum that I had a teledoc appointment scheduled, and just due to the hecticness, I was unable to complete my own. And I'm very well versed in savvy with using this most of the time, I should say, but that is a concern. So how I would be curious if there's anything we can do to try to prevent those who generally would use that, if there's some type of partnership with medical, with the doctors. I don't know, but it is a concern. So thank you for sharing, and thank you for the good work that you all are doing, and thank you, Chairwoman. That concludes my questions and comments.
Councilman Miller?
Yes, Madam Chair, I have about 3 general questions for the director. Is this the right time for those, or would that come later?
Oh, no, you can answer them now.
Okay, the first question is regarding this new model that you've put in, whether you have enough information to say that the new model is effective, and if the model is effective, is it effective because clients are getting better services, or is it effective because it's administratively more efficient, or is it some of both?
So at this point, given the considerable amount of turmoil in the community right now due to COVID, I think it's early to say its effectiveness compared to our old model. I will say that, and based on the testimony today, that the old model would not have supported our clients nearly as well as this model has during COVID. That central point of communication and these providers, Maximus, the centers, able to address barriers either through their subcontractors or through their staff. And that client, which was one of the goals, although no one saw COVID coming, the goal was to have that central point of contact. And the COVID crisis has highlighted how that is very beneficial to the clients at this point. And we are lucky to have had that model in place during this crisis.
My second question is based on that the change in scope of services for this amendment is March 9th of 2020, and some of the other contract dates reference June 30th of 2020. My question is, why did it take us so long to get this legislation here before the council?
So I'm going to speak a little bit, and Chris Alexander may speak as well on this. Obviously, when COVID hit, our first priority was to get our staff safe, to provide service, continue to provide services during this crisis. We also want to have a model that ensured the health and safety of our clients. That was our primary focus. And as we were doing that, we realized we need to change the scope of some of the performance measures that we were putting in the contract that had been placed in the contract. So that had to be done. We also had to go back to providers and ask them to change the way they were delivering services during COVID, obviously, and you've heard some of that testimony today, as well as ask them to revise some of their budgets based on what was happening out there as a result of this, and as a result of just the overall referrals that we're seeing coming in. That all resulted in delays in getting the contract done in a timely manner. There were some other delays that Chris can speak to, so I'm going to ask her to speak to them now.
Good afternoon, Chris Alexander, Contract Administration, Health and Human Services. At the risk of repeating what's already been said before, obviously, on March 9th, when the county building shut down, one of our two providers is actually co-located in Virgil Brown. Between the two providers, we had several dozen staff that had to actually move our service delivery to a remote work environment, while also transitioning hundreds of clients that were currently active digitally to be in contact with those providers. At that time, which was again March, we would have been working, we had started working on the July 1 amendment. However, we were advised by our law department that this change in service delivery would actually require amendment to their contract that was effective the date of the shutdown and the switch to the remote work environment. So this occurred at the same time again that we were preparing the contract for July 1. It was then determined that rather than having two separate amendments, they would literally overlap. And what happens is when we have an amendment in the system for an existing contract in our in-force system, it freezes our ability to actually pay invoices. So we were determined by the law department to combine these two amendments into a single amendment. And that's why that resolution reads as it does. To Kevin's earlier point, some of those performance definitions were revised and revamped to reflect the current job market, the economy, and many of our clients that actually been placed in jobs through these providers actually either lost jobs or the ones that were in jobs and were set to hit a retention benchmark may not be able to actually hit those benchmarks due to furloughs. In the in-force system, you know, we sent this normally goes to the law department for revision. So again, we had some delays during the summer of staffing in the law department. Some of the furloughs also delayed those, but we received the final revisions from our law department and signed copies in early August for the July amendment. What ended up happening is we've then received invoices from one of our providers from the first contract year that we were again unable to pay for May and June in that in-force system. So we had to release everything, pull it out of the system, make the payments, put it back in the system. Again, these are just mechanical things that have come with the transition to the new procurement system. It's just kind of dragged us along in a time that we would normally have prepared and finished this amendment in late spring.
Okay, thanks. And my final question is what the relationship is, if any, between this program and the sector partnership workforce programs.
Moment. David Merriman, Department of Health and Human Services again. You know, the intent coming into this current year was for there to be a strong relationship between our providers, the Department of Development, and the broader sector partnership structure. Much of that was being implemented as COVID began. Specifically, Magnet is the lead provider for the manufacturing sector partnership. Magnet is working very closely with the Workforce Development Board, as are we. The Workforce Development Board receives contracts and services to manage our individual training accounts. We fund the Workforce Development Board to be co-located in our buildings so that we can leverage their connection to the sector partnership in other resources. Along those same lines, we were working with Tri-C and their sector partnership for healthcare services. We had Kevin Gowan included in all of our meetings as we prepped for a broader relationship and more significant referral. That too has been paused as we respond to COVID. Our providers will be directly supporting their work as it comes back online. Unfortunately, organizations such as Tri-C are still trying to determine how they can provide classes and services while keeping students and staff safe. So it's disrupted this year. It's still in place. It will improve moving forward. And
one follow-up, who is the lead agency on the IT sector partnership?
My understanding is the right board.
I'm sorry, I didn't hear.
It's my understanding is it's the right board, but that I will confirm that.
Okay, thanks.
Any other questions? Administrator Merriman, is this second reading suspension requested?
Yes, please. Yes.
All right, I'd like to, if there's no further questions. Chantel, any questions? Okay,
Make a motion.
all right. Can I have a motion to move this to the full council on under second reading suspension?
I'll make the motion.
Second by Stevens.
All right, been moved by Brown, seconded by Stevens. All in favor, say aye. Aye.
Aye.
All right. Thank you very much. Madam Clerk, if you could read the next item into the record.
Resolution number 2020-0203, authorizing an amendment to contract number CE 1700229 with mental health services for homeless persons, doing business as Frontline Service for coordinated intake and assessment services for homeless individuals and families for the period January 1, 2018 to August 31st, 2020, to extend the time period to December 31st, 2021, and for additional funds in the amount not to exceed $800,000.
All right, and who is here to present today?
Madam Chair, David Merriman, Department of Health and Human Services. I'll be asking Ruth Gillette and Melissa Sirak to present this. I do want to take the time to thank all of the staff that were here from the prior item. I think you were free to drop off this Zoom call and to move on. So I'm going to ask Ruth Gillette to come forward and present this first item with mental health services.
Good afternoon.
Good afternoon.
Nice to see everyone. This first item is to extend the time frame of this contract to 12/31/2021 and add funds in the amount of $800,000. These funds are awarded from two sources. The first is the federal Hearth Act for $500,000 and the state homeless crisis response program through the Ohio Development Services Agency to provide support for the coordinated entry system in Cuyahoga County, continuum of care. The Hearth Act, through the Hearth Act, COCs are required to implement a coordinated entry system for the following reasons. First, to assure that the highest need households are prioritized for the limited resources available within the COC area. Second, to develop accurate, consistent, and timely data input into the homeless management information system. Third, to be able to track subpopulations of homeless veterans, youth, families, and chronic homeless persons through the development of by name lists, and then to pursue strategic housing initiatives for each of the subpopulations. In addition, the coordinated entry system assures that we're able to remove racial bias from the allocation of resources within the COC. Frontline Service operates the coordinated intake system in our community. Since COVID, the assessment, diversion, and referral processes have been by phone only. Frontline has implemented specific coordinated entry protocols focused on trauma-informed care and specific community services for youth, for veterans, for domestic violence and human trafficking survivors, and LGBTQ persons that are seeking housing assistance. Angela Glasgow, the CFO of Mental Health Services, is on the Zoom call if there are specific program questions that committee members have.
I have one, and I guess it's either for Angela or Ruth. It's very important to try to assist the homeless population in moving into housing. During COVID-19, how was that navigated, so to speak, or what were the restrictions?
So, to the chair, during COVID-19, and this will get into the next item, but you know the first focus was to deconcentrate the single adult shelters and to support all the shelters in trying to develop social distancing, you know, sharing information about the CDC guidelines for congregate shelters, working with the emergency management administration here at the county to get PPEs out to all the shelter staff. And so there was a kind of a pause at that moment of people kind of getting reorganized to this new system. Quickly followed by, and then for the rapid rehousing program, which is funded through the Department of Housing and Urban Development and has pretty strict rules around how that is to be implemented. For example, prior to rent being approved for a unit, it has to be inspected through an HQS housing quality standards inspection. So, and in addition, people who receive rapid rehousing, their eligibility through income, for example, and homelessness has to be documented. So HUD immediately through the CARES Act enabled communities to waive some of these requirements. So for example, people didn't have, you know, the staff didn't have to do on-site inspections. They could do a remote inspection and other accommodations so that people wouldn't be held up in having their rapid rehousing process. And so after sort of an initial pause, staff at Eden, which is the rapid rehousing implementer, and at the shelter levels, you know, have come together to really expedite placements. And you know, Melissa has been particularly involved in a really focused, what we're calling hotel to housing rapid rehousing effort, where there's a very targeted approach to moving folks from the hotel into the rapid rehousing. And one of the side benefits, if you will, of being able to house people in hotels is that to a large degree, people are able to experience what it's like to have their own space, and it's an enormous incentive for them then to really pursue the rapid rehousing option. So, sorry, that's a long answer to your question, but I guess the point is that while there was an initial pause, since then the numbers have really increased, and we're exceeding housing placements from last year. And I'd be happy to share that data with you. I think some of that data was shared at the advisory board meeting, but you may have gone off it before we got to that. So we'll send that out to you. But the numbers of people moving from shelter into rapid rehousing have gone up for all the populations, for youth, for families, and for single adults.
Okay, thank you. Thank you, Director.
You're welcome.
All right. Any questions for Director Gillette? Are we still hearing a part of the presentation from Melissa? Ruth?
Well, I think I was going to go through the next set unless you'd like to say hello to Melissa. She's here, and I'm happy to share the mic.
Okay.
Good afternoon, everyone.
Good afternoon.
If I have not met you, I'm Melissa Strapp with the Office of Homeless Services. It's nice to formally meet everyone again. I think I might have once pre-COVID. So nice to see you all. Do you have any particular questions that I could answer for you?
Oh, no, I thought you were going to present part of the presentation as well.
I can do the following item. How about that?
All right. So let's finish with the first one then. Was there any questions for Director Gillette? All right, hearing none. Director, I know what to do with the next one because I read your email, but in the current one that's before us, would you like that second reading suspension?
Yes, very much. Thank you.
All right. Can I have a motion to move this to the full body under second reading suspension and a second?
Also move.
Second. Brown.
Okay. Miller on the first, Brown on the second. All in favor of moving R 2020-0203, a second reading suspension to the full body, say aye.
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 Right. Madam Clerk, if you could read the next item into the record, please.
Resolution number 2020-0204, authorizing an amendment to contract number CE 1700066 with Lutheran Metropolitan Ministry for emergency shelter services for single adults at the Men's Emergency Shelter located at 2100 Lakeside Avenue, Cleveland, and coordination of overflow shelter services at various locations for the period May 1st, 2017 to December 31st, 2020, to change the scope of services effective September 29, 2020, and for additional funds in the amount not to exceed $3,627,924.
Thank you. And I take it Melissa is here to present.
Yes, good afternoon, all. This contract amendment includes coronavirus relief dollars that were approved by the executive and submitted to council for approval. Since March 21st, the COC has worked with LMM to implement a deconcentration of shelter populations to reduce the transmission of COVID among clients and staff. This was done by securing hotel spaces, providing food, staff, and security as needed. Unsheltered, highly vulnerable persons have also been included in the hotel resources. To date, there are approximately 279 hotel rooms and 4 hotels accommodating 350 people. These funds will assure continued access through the end of 2020. Mike Searing, the shelter director of LMM, is on the Zoom call should you have any additional questions.
All right, I'm just going to mention before we hear from Mike, there will be a committee meeting set up for somewhere in October at one of these Health and Human Services Committee meetings to fully dive into a couple of concerns that I have in terms of homeless services in regards to what is our future outlook for the shelter and hotels, as well as the moratoriums that are ending for rental assistance and how that may increase our numbers. These are conversations that I have had with David Merriman, but I would like you guys, you and Ruth, to present. So I just wanted to get that out before you signed off. And Mike, if you have something that you would like to share about LMM.
Sure, thank you. And thanks to the council for the support on this. Just a couple of brief data points, but one just overriding comment that we continue to meet the need for anyone that needs a homeless shelter bed. This community is really one of the few in the country that does that. So I'm just really proud to be part of the network that accomplishes that. Melissa gave a couple of the data points. I have a few more that I can add. I was looking at some data over the last 4.5 months, and we've served 600 unduplicated count of people. I averaged about 340 people per night. Melissa mentioned that's in 279 rooms. There are a couple roommate paired situations. We've done over 100,000 meals. And the main point of this is to deconcentrate shelters. And we've done that by about 50% of shelter reduction between 2100 and the Norma Her Women's Shelter. The YWCA is a great partner in this strategy as well. We also, to date, have done 39,200 hotel bed nights. And lastly, due to the Metro Health partnership on testing, we've had about a 4% positivity rate of the shelters. And I'm just thinking, like, nationally, the overall rate is about 7%. And some early projections were among the homeless community, it could be as high as 40%. So I think that these strategies and partnerships are going as well as they could.
Mike, I wanted to ask a question. I just want to be clear. So we have some hotels, and are we still utilizing Norma Her as well as LMM 2100?
Yes, yeah, both shelters are operating with these additional precautionary measures and spacing and all of that. And the hotels have really freed us up to be at about half of our normal capacity.
Okay, and so talk just briefly a little bit about the equity of how you determine who goes to a hotel and who stays at the shelter. And I know that primarily the hotels started when there were individuals that were susceptible to COVID or had COVID.
Mhm. Yeah, exactly. That was our very first sort of it. We took the older population and people that had health concerns and got them really out of the shelter immediately. And since then, we've been able to broaden it to pretty much anyone in the shelter, other than someone that might really need greater attention and shouldn't be like in a room by themselves, people that we know have like known addiction issues. And then also anyone who has had some kind of like history of violence or assault or something like that. So other than that, everyone is able to go. And we have a pretty short wait list. Basically, after someone tests negative, they're offered hotels. So thankfully, it's not like a real like long list where we have to pick and choose, but it's an option available to everybody.
Okay, thank you. I'm going to open it up to the committee. Any questions for Melissa or Mike in regards to this? All right, hearing none, you guys are getting off easy. All right, I'd like to make a motion to move this to the full council under second reading suspension. Can I have a second?
Second.
Second.
Yeah.
All right, I got a lot of seconds. So Conwell on, on the first and Miller on the second. All right, so if there's no further questions for our guest, I do have some miscellaneous business I'd like to share. We thank you all for coming and presenting and participating today. We know you're doing hard work, and there's hard work still ahead of us because we don't know where the pandemic is going to go or when we have a vaccine. But thank you again from us, and you're more than welcome to continue to listen to us, but we're going to continue on. So if my colleagues would just spare me to have some miscellaneous business, and if you have any to share, please do so. So one of, yeah.
For the full vote, you did
Oh,
make.
sorry. All right, we did do the motion, and the second is if we can have everyone vote for a second reading suspension to move to the full council for R2020-024. All in favor say aye.
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 Thank you. Thank you, Councilwoman Brown. So now we're moving on to the miscellaneous business. It was asked in Human Resources Appointment and Equity Committee yesterday to send the Citizens Advisory current members to council, and it was done so. I also sent some additional questions to Ms. Crossman. And I asked her about what was the protocol and how did they determine the replacements of the members. And she stated it is basically by the predecessor. That's how they've been replacing the members because we've had a few replacements in the Citizens Advisory. And has it been determine if there is a term limit on the Citizens Advisory Group? Because I did miss a couple of meetings. So they currently have a 4-year term. So I wanted to let you guys know that information as well, since that was a hot topic yesterday. Number 2 item, there was some correspondence sent to David Merriman regarding the de-escalation training being looked at for cost effectiveness. And you guys were privy to all the notes. I did follow up with you guys yesterday with the notes of that meeting. And it was stated that Director Wisekettle would look into the state of Ohio training. And I think that may be a little bit more costly. In a meeting that I had with Scott Osiki, I was mentioning some of the issues that we were having as I was hearing from his, and he did state that they do that as well. They do that same kind of training. So that was the correspondence that I sent to Dave Merriman to look into that and to really look at the cost effectiveness of training all frontline staff. So if you haven't read the notes, they're the staff that need to transport and be in direct contact with the children and the families every day. There are essential workers. And when we have incidences and we're not allowed to put our hands on the children, the technique that they utilize is de-escalation. Well, in the meeting, Cindy kind of led to that it's a kind of like a one-time training for maybe 48 hours. I don't remember the exact numbers. And so that was some of the conversation that maybe we need to increase that. So staff can utilize it when need be. Any questions in regards to that? All right, moving on to my third topic, the Cuyahoga County Board of Developmental Disability. They want to provide updates. So that scheduling is being worked on, and that should be presented sometime in October. We're just waiting on them to give us dates. And my fourth item would be updates regarding children's room, safe transportation of children, and other important concerns. And that was all sent out in an email yesterday. So please read those. And my fifth and final update would be that I received, and I don't know if some of the Health and Human Services Committee members, if you have received, there was a statement sent out by Margaret Mitchell, and she has some statements, personal statements that she sent out regarding the racial equity issues within the homeless system. And she sent out an email asking how we should proceed. Me and Levine have discussed this, and we're kind of thinking maybe this is something that needs to go to racial equity. And I also had a conversation with Executive Budish on it. But before we move on that, I reached out to Margaret, and I would like to have a conversation with her on a conference call to fully understand exactly some of the statements that she made and why she feels there has not been any progress. So I will keep you stay tuned on those things. And I just wanted to share that since we're not physically seeing each other and I can talk to people virtually. I wanted to make sure that those items, that are being worked on. And is there any miscellaneous business from any of you?
No, Chairwoman, but I do want to thank you for that, for those reports and bringing us up to date. I really do appreciate it. So thank you.
Oh, no problem. Thank
And
you.
Madam Chair, I did have a question. I just wanted to allow you to get through all of it. But when you mentioned the, I believe that related to the Jane Edna Hunter building, as far as the training, was I understanding that correctly? The training
Yes.
of how to de-escalate as opposed to putting hands on, is that the solution, or are you giving us an update on the conversation that's happened? Or is that what they believe the solution to the problem is?
No, I'm giving you a conversation I'm giving you an update on the conversation that was had. The way state law is, we're not allowed, or security or coworkers or social workers are not allowed to put their hands on. So one of the techniques that they utilize is de-escalation training. Well, the de-escalation training, when we got more in depth in the meeting, how often is that presented? Because we have children that are walking out the door. So we're trying to work on, and when is it appropriate to put your hands on a child? Because we know we have children that, this all affects our costs. We have kids that'll come in and then they'll run away, and knowing that we can't stop them, de-escalation would be more, I guess, if there was an anger outburst or something like that, but we can't stop them. It's still costing the community, whether the cops are involved or something, in terms of the children leaving. So I'm really trying to get a handle on this and see if there's some kind of help that the state could provide us with, maybe changing laws. I don't know, because, you know, I don't want to infringe on anybody's rights. So it's just the conversation that we're having. But according to the administration, that was what Cindy brought back, is that she feels that we need to increase the de-escalation training from all frontline staff, which is going to be a pretty penny that we would have to probably discuss during budget time. So I'm just trying to mitigate that, since that is a suggestion and is needed. Someone else that might can do it at a more cost-effective measure. Does that answer your question?
It does. Thank you very much.
All right. Any other questions in regards to the updates? All right. Hearing none, I hope you all have a blessed day. And I know some of you have another committee to be on. God bless.
Thank you. Bye.
Bye-bye.